let's set our focus to this now. The Northwest Department of Health may soon emerge from years of Section 100 administration. The Constitution allows national government to take over administration of provincial departments to prevent catastrophic failure. In this vein, the Provincial Health Department was plagued by allegations of fraud and corruption, embroiled knee-deep in the controversial Gupta-linked Mediosa scheme. It was one of 10 Northwest departments placed under administration. Some observers have noted significant changes for the better, while others have claimed these are negligible, as told to the Daily Maverick. Now, joining us to discuss the current state of affairs in the Northwest Health Ministry are Kelebogile Kerileng, EFF member of the Northwest Health and Social Development Committee, Gavin of the Democratic Alliance, as well as NEHAWU Provincial Secretary Ntombizodwa Moepeng. Good evening to you, and thank you very much for your time and for joining us today here on In Focus. It's, of course, a plan that was never going to be a permanent one. It's one that at some point we would need to ask the question, is the situation better now? Has the administration been able to rehabilitate the Northwest Health Department? At the time when they came in, the medicine shortages, there was complaint about lack of ambulances, there were complaints about the filling in of vacant posts, there were complaints, of course, about the Mediosa scheme, there were complaints about a complete collapse of the structure in the province in terms of the bargaining structures. Have things moved forward for the better? Kelebogile, let's begin with you. Good evening. You can unmute for us and we can get into the conversation. Has the administration rehabilitated the Northwest Health Department?
Let me start off by saying the intervention into the Northwest dates back to 2018. Is when the government invoked Section 100 of the Constitution to place certain provincial departments under administration. Then the Department of Health is one of the attended departments. The reason for this intervention was due to corruption and lack of service delivery. And as EFF, we have never supported Section 100 intervention in the Northwest, as we believe that there is nothing that the ANC-led government can do to change the living condition of the people of the Northwest province. If you can remember, the Speaker of the Legislature even sent bouncers to assault us when we questioned logic of the intervention in 2019. So.
Yeah. But my question maybe is let me be a little bit more direct. I mean, the objective was to bring some semblance of stability in the department. The first issue, for example, was to address the question of vacancies. According to the administrator, Dr. Janet Hunter, reports that vacancies were brought down from 19% to 11%. So about 5,000 posts were filled. In terms of the work plan that was set for them to do, it had 111 activities and 102 were completed, saying it's a 92% success rate. Do you see that on the ground in terms of health services?
In answering the question, absolutely nothing. Nothing. From 2018 till now, those who were involved in allegations of corruption have not been prosecuted. Nothing has been achieved by these interventions, as the perpetrators are still out there and not jailed. The intervention meant that a complete takeover by the national government. However, if that is the case, the situation is still the same.
Yeah. All right. Let's get Gavin in. Gavin, is it easier today to access health services in the Northwest, especially in rural areas, having had the administrator intervene?
Thank you. I think your question should be taken a little bit further back as to, is it better than when? If we're referring to the time that the Northwest Department of Health came to an absolute collapse where there was absolutely no service delivery. The entire service had basically been brought down to a complete standstill through corruption, through all sorts of malfeasance in the different departments, including the Department of Health. I suppose my answer to the question would be yes, it is a little bit better. There's a little bit of stability. And I use the word a little bit. But we mustn't forget the fact that this should never have happened. We should never have got here in the first place. We are now rebuilding on a system that was crashed right into the ground by corruption, by the Guptas, by the Mediosa scandal, and many others. And I must share the views of my colleague on the platform in that where are the criminal cases? Where are we? How did we get to this situation? If you're comparing the absolute collapsed phase till today, there's small improvements, but quite honestly, these improvements are not really touching the lives of those people accessing the services. We come down from a high vacancy rate to a proud 11% vacancy rate. That's nothing to be proud of. In 4 years, you still have an 11% vacancy rate. You're still overspending certain budgets and completely underspending other budgets. Is it translating to the person on the ground that needs healthcare services? I don't believe the intervention has yielded the results it was intended to yield. And I don't think we should ever have gotten there in the first place, sir.
Yeah. Let's talk about this issue, Ntombizodwa, that is being raised here. I mean, when we were looking at this situation in 2018, workers, in fact, were demonstrating, threatening to set alight the offices of the Department of Health. The entire bargaining structure in the province had collapsed. You were calling for the filling of vacancies. The administrator saying 5,000 posts were being filled. Even now, during the 2022 financial budget, the MEC was saying just over 1,000 posts again were being filled in this financial year. Does that go further in resolving the issue of shortage of staff, according to NEHAWU? Please unmute for us.
Okay, thank you very much, and good evening. In terms of the collapse of the bargaining structure, as NEHAWU, we are still not happy, and we want to say the chamber is still dysfunctional, and we ended up seeking intervention from the national office. As things stand, on the 13th of July, the national office will be descending to the Northwest Province to come and assist labor unions at the level of chamber, so that we must find solutions to the problems that we had. Workers are still not happy. PMDS, like it is one of the issues that we raised in the memorandum in 2018. We can safely say, even today, workers were not paid PMDS accordingly. What we rather saw is senior managers of the department paying themselves a chunk of monies and denying the production workers performance bonus monies. And under administration, we have seen workers being put on suspension. There are prolonged suspensions in that department. More than 30 employees, including senior managers of the department, some of them are still on prolonged suspension. And the suspensions must be dealt with within 60 days. Yeah. So really, the administration did not yield positive results in terms of the workers. As for the filling of vacant posts, we don't know. I think when the administrator is saying vacancy rate is now at 11%, that must be backed up with proof. Yeah. From where we are sitting as NEHAWU, from the chambers, we know that it is 16%.
Yeah.
So what the administrator is saying, really, the administrator is misleading.
Yeah.
We're still having employees who are overworked. You go to all the hospitals in the province, you find 3 employees under the section of corporate services, workers who must deal with condition of services. Then you find only 3, less than 10 employees in that section in a hospital that is having more than 1,500 employees. Really, the Department of Health, really the Section 100 in the Department of Health has failed this province.
So there is still severe understaffing that still persists in the province, you say?
There is still severe understaffing. And what we also saw under administration, now we are faced with closed off hospitals. Some of the hospitals, we have a hospital here in Ngaka Molema Tusong Hospital, where the department said there is dolomite soils and everything. Stories were created about that hospital. But the hospital was left to dilapidate to a point whereby it cannot be fixed. There was a budget in 2019 to renovate hospitals such as Sanisof hospitals and other hospitals in the province, your Moses Kotane hospitals. If you go to many of our healthcare institutions in the province, really they have dilapidated to a point whereby workers are not supposed to enter those buildings.
Yes. All right, let's take a break. When we come back, we'll talk more then on the emergency medical services. We'll talk about the manual record keeping and the handling of finances as well, what the challenges are there. This as the province gears itself to come out of the Section 100 administration, saying things have improved, but there is still room to do more. What are you experiencing on the ground as a resident in the Northwest Province? Has the administration rehabilitated the Northwest Health Department? Give us your views tonight on 072-110-5584, or you can tweet us at Newzroom405. We continue in a moment. Back with you tonight here on In Focus, and thanks for staying on. We continue then in our conversation as we look at the health department in the Northwest and improvements or lack thereof that have been put in place. Before the break, we were looking at the question of vacancies and whether or not those have been sufficiently filled. By the way, we did reach out to the Department of Health. We did reach out to the administrator to be a part of this conversation. They could not come back to us on time for this conversation. However, we do have with us EFF in the Northwest, NEHAWU, as well as the Democratic Alliance as part of the conversation. Gavin, let's talk about this question that NEHAWU is raising of underspending in terms of revitalization of the facilities. Of the 14 billion budget of 2020-2021, there was an underspending of 1%, and the department saying, well, this is underspending on the revitalization grant, actually amounting to about 144 million. Are there satisfactory answers being given as to why, if there are hospitals that need to be revitalized, that amount of money has not been spent and had to be sent back to Treasury? Gavin, please unmute.
I think if you're a patient in the hospital, I don't think there could be any excuse for you to be in a facility that is crumbling, falling, the facility is not working correctly. We go into these facilities and we see and experience what it is that the patients are seeing and experiencing. And unfortunately, the department they are fairly well known for not spending their maintenance budget in the places that it should be spent, or spending it at all for that reason. So I don't know how you could justify not spending your maintenance budget, even if you are telling us that you're missing it by 1%. The reality, the lived reality of patients on the ground is that our healthcare facilities, and especially in our rural areas, are really not in a good state. We regularly come across clinics that do not have hot water, do not have emergency supply of water or electricity. The facilities themselves are run down. So to answer your question, I can't see how it can be acceptable to use any excuse for not maintaining and keeping your facilities in a good care, especially in the healthcare environment.
Yeah. Kelebogile, there's been some issues resolved, according to the department, around the inability to promptly respond to provincial health transport needs. Here's what they're saying. They've procured a new fleet. In 2018, there were 50 ambulances. In 2021, they had procured more, so they were sitting at about 147 or 138 that are currently available, as opposed to the standard of 350 EMS vehicles provincially that should be available. They are saying the next option is to lease so that they could be able to have more vehicles with the current budget that they have. What does the EFF say to that?
We saw in the annual performance plan this year that the number of ambulances in the province have been reduced, and it will affect most rural communities.
So you're saying this reported increase of 50 to 147 is not how it actually is working out on the ground?
Yes, it will never ever work.
So what do you make then of the option of leasing more vehicles because of the limited budget?
The communities that are affected are communities of rural areas.
Mm.
They have to pay transport to go to hospitals. Some of them, the clinics are not operating 24 hours. So it is important that the number of ambulances must be increased in the Department of Health. And again, more especially to the rural area clinics.
Yeah. And in your own walkabout and your assessment, what is preventing the department from getting more ambulances?
The underspending of the department budget is still persistent. Irregular and unauthorized spending still take place, more especially corruption.
Yeah. And Ntombizodwa, as NEHAWU, I mean, do you get a sense that the department is valuing healthcare workers in the way that they should be?
Yeah, thank you. We don't think healthcare workers are valued by the Department of Health in the province. I will cite some of the examples where recently we had nurses who are providing specialized services, but they were still given the salary of general workers, of general nurses. Then that shown that the department for many years did not care until when the union raised issues, until when workers themselves withdraw labor. That is when the department will act. And the other thing that one will want to raise as one of our strongest concerns as the union is the adoption of community healthcare workers. Those workers are workers who are providing primary healthcare services in this department, are workers who do door-to-doors, are workers who are able to trace patients who do not take their treatments and whatnot. But those workers, they are not taken serious by this department. The department will only focus on the reports. What is it that the workers are doing is what the department is doing. But in terms of recognition, in terms of giving them their overtimes, because we saw during COVID-19, those workers, the community healthcare workers, went they overstretched themselves. They went extra miles to make sure that they trace patients who did not, who relapsed. But still today, we are still fighting with the department to make sure that they give them the overtimes, because they work for overtime. So also other workers, because as NEHAWU, we are organizing across the board, and we are organizing more than 90% of workers in the Department of Health in the province. You find that we have workers under administration. Also those workers remain frustrated under administration.
Yeah.
And we did not see anything from the Office of Administrator making sure that what workers raised in 2018 was attended to.
All right.
So workers remain frustrated, workers remain overworked, workers have got burnouts because of lack of leadership even under administration.
Talk to me about the 30 employees who you say are on suspension at the moment. On what grounds have they been suspended? What are they charged with?
Some of the employees, one can safely say, they told the union, as we are the ones who are representing them. Some of them were charged for not carrying unlawful instructions, especially the senior managers in the department. Some are shop stewards of NEHAWU who raised issues of workers, but the department chose to destroy these shop stewards. They are still at home. It's more than 2 years now. They are being paid for staying at home, and the department is saying nothing. They are breaking these processes of hearings, and that thing really it is not good for the workers themselves. It is not good even for the union, and we want to plead really with this department that something needs to be done. At least when this administration comes to an end, the administrator cannot leave this department without concluding some of the problems she has created for the department. Really, administrator will have done injustice to the workers of the Northwest Province in the Department of Health and to the people of this province.
Take a break. When we continue next, we'll wrap up the conversation, then look at what needs to be done to expedite the ICT infrastructure development, the medicines availability, delivery timelines that have been a bit of a challenge. See some reports there indicating that the Northwest healthcare is suffering medicine stockouts. Find out why and get to the bottom of that. Let's hear your views as well as we ask that question. Has the intervention of the administrator in the Northwest Province made the health services more accessible for you? What are your thoughts? Tweet us at Newzroom 405 or 072 1105584. We continue in a moment. We're back tonight on In Focus as we look at the situation of the health department in the Northwest and whether there is recovery and grounds to believe that the administrator has done its work in terms of implementing its plan, and it's time for that province to be lifted out of a Section 100. Kelebogile Kerileng of EFF in the Northwest. We also have Gavin Edwards. He's a DA member of the Northwest Health and Social Development Provincial Committee, and we have of NEHAWU and Ntombizodwa Moepeng as well with us. Gavin, let's come back to you with this question. What is prohibiting or hampering is a stumbling block, right, in improving ICT infrastructure and automating the healthcare department's document management and information generation processes? This is one area that even the administrator admits that they have failed here. They have not managed to actually move an inch on this particular.
I think the Northwest Province is a unique province due to its rural nature. So that automatically presents difficulties in connecting our province. But I do believe that way more could have been done over the last 4 years. It is rare that you would find a clinic or a hospital that is adequately connected to the internet. I have yet to find any clinic or hospital that has any type of electronic record-keeping system. And I think we must understand that the lack of an electronic record-keeping system or adequate record-keeping system adds to the woes of this department, exposing them to medical litigation. It exposes the staff to personal liability and all sorts of other complications that could be avoided. What could be done? We've been proposing in the committee for years to look to other provinces and see how they're doing. I know that in the Western Cape, they're doing a wonderful job of an integrated digitalized system throughout the entire healthcare system, clinics, hospitals, and ambulances as well. But there just seems to be no movement on this. There just seems to be no movement. It seems that it is easier to say it can't be done than finding innovative ways to finding the solutions. We must also remember that we have the Northwest University right on our doorstep. And I'm sure that there could be some kind of IT boffin there that could advise, guide, or implement something in the Northwest Province that could take that baby step at fixing this challenge. But I just want to bring something back to the table that was raised by NEHAWU. You're never going to move on your IT systems or any other system when you're paying 16 million rand every 500 days for people that are sitting at home, not doing work, not being in the office where they need to be. You're never going to move when you're not spending your budget in the right places. So I think we can't fix the one thing without causing damage to the other, or expect one area to fix itself if you're not fixing the rest of the problems in a unified approach.
Yeah. You share the sentiment of NEHAWU that the administrator would need to sort out this issue of suspensions before she leaves office?
Yes, absolutely. No, absolutely. Absolutely. I mean, we have people, senior staff members, sitting at home for more than 500 days, unproductive to the department, not contributing any type of work, and they're getting paid for it. The administrators should have brought these matters, concluded these matters. If there's disciplinary action to be taken, take the disciplinary action and move on. If these people are ill-disciplined and things have not been done correctly, they need to face the music, or conclude the matter and allow them to be found not guilty in whatever it is they're accused of, and move on. People should be paid to work, not sit at home.
Kelebogile, I see on the issue of fighting corruption and money matters, the department saying they've got a challenge with accruals. In other words, they are not paying suppliers in the required financial year, and they are carrying these over to the next financial year. What do you think is behind that? But also, while we talk on fighting corruption, what do you make of the arrest of the head of health for fraud and corruption relating to the Mediosa scheme?
There must be a disciplinary hearing to the officials of the department. There should be proper investigation, and all people that are investigated and being found to be corrupted, they must face criminal charges and also be dismissed in their positions.
Yeah. And what is behind the accruals then, the non-payment of suppliers? Have you investigated that?
It's a corruption and comrades deployment.
Oh. Yeah, all right. That's Kelebogile, they're saying it's corruption and cadre deployment that is behind those accruals. Let's talk then about the medicine availability. Ntombizodwa, medicine availability is still quite a big challenge. Most of the medicines not available at the time that they are required to be available. They're saying there's an issue with delivery timelines for medication. How do you assess the question and the challenge of medicine availability?
You know, that the medicine availability, because it will be directed to our members, where the department is saying workers do not want to work when they know that there is short staffing. The department must make sure that they employ more workers so that there should be a fair distribution of, or they should make sure that medicines are taken to clinics on time. But also with this issue of medicine, it is not about medicine not arriving on time in clinics or in hospitals. The department must be honest on this one. Are there medicines, or is the department still failing to pay service providers who provided medicines in previous years? Or what is the real problem? According to the union, according to us as NEHAWU, short staffing is one of the challenges that the department must fix.
Yeah.
The other thing, from the little staff that the department is having, they must make sure that they give these employees overtime allowances, because for our members and for workers in general, workers do not mind to go extra mile. But the problem is workers will go extra mile when they are supposed to be paid overtime allowances. The department is also failing to give them overtime allowances.
Yeah. Gavin, I saw you nodding there. You want to reflect on this question. So, I mean, if you listen to the MEC saying, for example, ARVs, they are at 90% of stock. I think TB medication as well. They are well stocked, saying there's no question of shortage of medicines per se, but it's a question of delivery timelines for the medication. That's a little bit of a challenge.
Yeah, no, that is partly true. That is partly true. The medicine depot, the provincial medicine depot, has a significant storage of medicines available. But I think it's a double-edged sword, and I think we need to be honest with ourselves. There are instances where we do have medicine outages, and that does speak to the accruals. It does speak to outstanding accounts. The MEC has acknowledged that some accounts are not paid within the allocated 30 days. That creates a back knock. That creates a knock-on effect. Also, we must remember that the department has, for the last 4 years, trying to claw its way out of the depth of the, we can call it the state capture days, or the Gupta days, or the Mediosa days. And the question is, how will we ever really deal with these accruals? How will we ever get out of the depth of those days of corruption? We must also understand that getting the medication into the patient's hand in the clinic is a complicated process, where it needs to be planned correctly, it needs to be procured correctly, and then in line with the colleague at NEHAWU, it needs to get to the right place, and that takes manpower. And unfortunately, the department is top-heavy. They have a bloated management structure, and they have a lot of gaps down on the bottom end, where the patient-facing side, and that causes bottlenecks if you don't have a driver to go to the medical depot to go and pick up your medical stock. So yes, there's a parallel system. Is it better? I think in the last while there has been an improvement. I've noticed movement on that. But try and explain that to an elderly patient in a rural area that's waited 6 hours, who coincidentally gets to the front of the queue and is told, I'm sorry, there's no blood pressure medication today, but if you come back tomorrow, maybe there will be. So has it improved? A little. Are we should be? No, not at all.
The period under administration is set to come to an end soon, though. Quick one from you, Gavin. Is it time to lift this Section 100?
I'm conflicted in the Section 100 from the start. As I said at the beginning of the interview, I'm not sure we should have been here. I'm not sure we should have gotten into this phase in the first place. I don't think that it is fair that the patients in the clinics are now having to deal with whatever it is that caused this mess at the outset. Were we at a place where we had no other option? Perhaps it was the only option at the time. Has the administrator overstayed her welcome? Perhaps she has, but she has a lot of work to do before she leaves, whenever that is. There's a lot of talk of this Section 100 coming to an end, and it depends which news article you listen to. We have not been officially informed when this will be coming to an end. So when they say shortly, does this mean within a month, 6 months, or a year?
Well, they say an exit report has been sent to the National Council of Provinces to sign off, and that the Section 100 intervention would be lifted there from that department in the province. Kelebogile, should they lift the Section 100 intervention?
The EFF does not see it necessary since there is no changes that have not been made in the real terms of intervention.
Yeah.
The intervention only shake the people, but the problem are still there.
Yeah, problems are still standing.
When looking at the cost of the intervention, one must look at it that relation to what would have been costs had been no intervention. A lot of money could have been saved for community.
Okay.
And a lot of money could have been used for community of Northwest.
Right. All right. Ntombizodwa, quick one from you. What's your feeling on the Section 100 intervention? Should it be lifted?
Yeah, it's time now. It's time now. Section 100 should be lifted in the province. The department must be left in the hands of the head of department who was appointed last year. The administrator's time has come to an end. And if, like we are saying as NEHAWU, that she must conclude some of the critical areas where she needed to conclude before she can go. But we do not want our members to be compromised along the process. If she's unable to conclude on some of the matters, let administration hand over the baton to the current management of this department. Maybe under the head of department who's appointed, things will be better in the Department of Health.
Appreciate you all for coming. Thank you very much for coming through. Let's quickly look at some of the WhatsApp messages tonight. Anonymous saying that Administrator, okay, let's start here, Kanye and Rustenburg. When the department talks of 11% vacancy rate, what is the baseline? Increased unemployment results in increased need for public health services for one reason or another. Has the structures of health facilities been reviewed to accommodate the increase in demand? The answer is, if the answer rather is yes, then 11% vacancy rate will have a senseful meaning. That's Kanya there from Rustenburg. JC in Pretoria saying the hospitals and all government entities are in shambles as there is no maintenance done or has never been done. Let's get one more from Anonymous. The administrator made things worse in the Northwest Health Department. They refused with 100% overtime. They pay only 30%, and we are short-staffed. Some of the reaction then tonight to the conversation ahead of the department being lifted of the Section 100 intervention. It seems an exit report has already been sent to the National Council of Provinces. Still